Well, we're taking your calls today for Dr. Zorba Paster.
The number to call, 608-270-9933. And we have 3 lines open if you have a question today.
Stay on the line. We'll get to your call in just a second. But first, Zorba, welcome.
Good to
Hi,
be here.
Zorba, good to see
And
you.
you want to talk about shingles shots. Only 30% of Wisconsinites have gotten.
Roughly, that's about what it is. And the fact is, shingles is awful. Anyone who's ever had shingles says it's just terrible. The pain lasts, of course, for at least 2 weeks, but for some people it lasts for 3 months, 6 months, or 9 months. For some people, the pain never goes away. It's the chickenpox virus that is in your body. So if you've had the varicella, immunization, you're never going to get shingles. But for people over a certain age, hey, the virus is in our body right now.
So if you had chickenpox when you were younger,
you are
need
risk
the
for
vaccine.
shingles. You bet, you bet.
And
now,
it's
the
2
Merck,
shots, right?
Right, the old vaccine, the Merck vaccine was about 60% effective, but the new vaccine, the GSK vaccine, it's a 2-shot vaccine. It's in the 95% effectivity rate.
Wow.
And it does have side effects, pain of the arm.
Check with your doctor because it's a live vaccine.
It's a live vaccine. You've got to get it the right way. Some people need to get it Medicare Part D at the drugstore. Some people at a doctor's office. But if you've had chickenpox, get the vaccine. You don't want shingles.
I've had shingles. You don't want shingles.
No, you know.
Let's go to the phone. We'll start with Aaron in Stoughton. Hi, Aaron. What's your question?
My question, Dr. Zorba, is is there anything better than gabapentin that I can do for my restless leg syndrome?
Oh, you bet, you bet. There are a number of drugs. They're really Parkinsonian drugs. Drug Requip, R-E-Q-U-I-P, which is now generic, works. Other drugs that will work for Parkinsonism also work for restless leg syndrome, and they're actually better than gabapentin for the most case. So talk to your doctor. There are medications that really can make a difference.
All prescription, though,
All
nothing over the
prescription
counter.
drugs, right.
Okay. Let's go to Tim in Baraboo. Hi, Tim. What's your question? Tim, are you there?
You bet.
Go ahead. What's your question?
Yeah, my question is, on Friday I had rotator cuff surgery, and I'm just wondering what would you recommend eating and to take care of so it heals better?
Oh, sure. Well, the answer is a really good food, high protein sort of diet. Mediterranean diet is going to be there, but I would have protein during the daytime. Certainly fish is the best protein. After that, of course, poultry, and then after that, meat. But I would stay on a good high protein, 60 grams of protein a day at minimum in order to heal yourself.
And Zorba's homemade chicken soup wouldn't be bad either. It's really, really good. And the recipe's on Channel 3000.
You bet.
All right, Rhonda in Beloit, you're up. What's your question?
I'd like to find out how scared are you about the 19 funguses that are really bad, but the 4 that you guys talked about just a little bit ago, how bad is this fungus? Like these 4.
Sure.
Is it here now in Wisconsin?
I don't think you really have to worry about fungal infections for the most part. Now, in the summertime, sometimes not cryptosporidium, but some of the fungi that are around that you have to worry about. But the fact is, we really don't worry about them. They don't affect most of us unless we're on chemotherapy or something that reduces our immune system. So if you're going to be afraid of anything, be afraid of COVID. Do not be afraid of the fungal infection.
And most of the ones in that story are in the tropics.
Absolutely. They do really rarely, and Wisconsin is not big on fungal infections. And the Southwest in the U.S., Arizona and New Mexico, they have more fungal infections.
Maybe one benefit of the cold, right? The cold,
right.
and the cold and the snow.
Kills it off.
Let's go to Virginia in Baraboo. Hi, Virginia. What's your question?
My question is, if I currently have cancer and have not finished surgery or treatment yet, should I stay away from the shingle shot?
Oh, I think you bring up a really good point. That's something to ask not only your family doc, but to ask your oncologist, because it's a function of what you're on, whether or not it's safe for you, whether or not the vaccine is okay. I believe it's a live vaccine. You've got to be careful if you're on certain medications. Your oncologist can give you the answer. You bring up a good point. That's why you go to your doctor to talk to your doc about whether or not the vaccine is for you.
It might be okay, it might not.
Might not. That's right.
Thank you.
We wish you good health.
Yep.
Continued good health.
Thank you for calling.
Thank you.
All right, let's go to Catherine now in Richland Center. Hi, Catherine.
Good afternoon.
Hi. What's your question?
I have had shingles twice, very light cases. If I would get the newer shingle shot, would that eliminate me getting them again?
It will reduce the chances that you will get shingles again. Now, will it eliminate it? As a doctor, I never use 100% of the time. I've learned not to say that, but it will definitely reduce the risk that you're going to get shingles again. If you've had it twice, you are a good candidate for the shingle shot.
Well, and that raises an interesting point that you can get shingles more than once.
Absolutely, yeah, multiple times,
Yeah.
right.
Okay, let's go to Marlene in Madison. Hi, Marlene. What's your question? Marlene, are you there?
Yes,
Go ahead. Go ahead. What's your question?
Dr. Zorba, I'm very nervous. Can that cause off balance?
You're very nervous, or you have nerve damage?
No, I'm just very nervous. Can that cause off balance?
Can that?
Well, if you're nervous, it's important to actually talk to your physician about it, because sometimes when you're nervous and you're older, you can be off balance because of that. And antidepressants can be a boon and very, very good for people who are off balance and nervous. But the other thing is you want your doctor to look over, and your pharmacist, all the medicines you're on, because a lot of people are off balance who are older are off balance because of side effects of the medications, or they're taking over-the-counter medications such as over-the-counter sleeping pills, which are Benadryl, which actually can throw you off balance. So you need a med check and to talk to your doc.
Good
All right,
advice.
We're out of time. Carol from Pewaukee wanted to know about 50 and over for shingles. Is there an age limit for the shot?
No, not at all.
Anybody
no
can
age
get it.
And no age
Okay, all right.
Okay.
Thank you for calling, everybody. Thank you, Zorba.
Great to
Pleasure
see
to
you,
be
Zorba.
here.
See you soon.